Good morning and welcome to our conversation today with people of color, Psychedelic Collective. Thank you, Francis and Charles, for being here today. Such an honor and privilege to share this space. And thank you all for coming together on your Saturday morning, and some folks on the East Coast, your afternoon. I'm going to just spend a minute here for us to just ground into this space. And so if this feels good for you, please join us. And of course, if not, please listen to your body. So we're just going to put our feet on the ground, settle into our seat. Right, feel the support of the earth, the support of the chair. And first, we're going to acknowledge this land, where I'm located, the Ohlone land. And please acknowledge the land of wherever you are located. I'm going to express gratitude to the plants and the trees and all the living beings that surround us. And we're going to invite our ancestors and spirit guides to this space for guidance, for love and support. And finally, I'd like to acknowledge the loss of life that we've experienced this past week, this past month, and in this past year due to COVID. I want to name Dante Wright, Adam DeLevo, and the many lives that we lost in Atlanta, our Asian community members. And as you reflect, maybe there's some pain that's arising, some trauma, or some transgenerational trauma. And so if it feels right for you, just noticing that, putting a hand there for support, and also turning to our community. And that's why we are here together, is to support each other. And if it's okay, feels good to you, we can take a few breaths together, a collective breath. Inhale and slowly exhale. Beautiful. So thank you. Feel free to open your eyes and just reorient yourself to this space. Thank you, Charles. Yeah, move that body. Really acknowledge that we need to channel that energy and move it. So if that means moving throughout this session and stretching, just knowing that that's what we need in this moment. My name is Mary Sanders. I'm a licensed clinical social worker. I'm a therapist, psychedelic integrationist, and a community mental health provider in San Francisco, providing support for formerly unhoused veterans in San Francisco. And I want to turn it over to Francis and Charles to introduce yourselves.
Hi everyone, my name is Francis. I use she, her pronouns. I'm here today on behalf of a project called the Asian American Drug War Healing Circle that I co-founded with my friend Rana Hashemi, and also here as the new drug overdose prevention education project manager. So I'll kind of be wearing both hats today because when we talk about people of color and harm reduction, yeah, these are kind of two different parts of myself that I like to weave together when we have conversations like this. I'll pass it to Charles.
Thank you, Francis. Hello, everybody. My name is Charles Hawthorne. I work with Francis at the National Harm Reduction Coalition. I am a capacity building manager, and I lead a lot of our harm reduction training work for syringe service programs and harm reduction programs and anyone who's doing work with people who use drugs across the state. I also am a trainer and facilitator, curriculum designer, and I do a lot of conversational work around how people of color interact with substances and how we can continue to have conversations specifically around how Black people can heal from the harms of the war on drugs and kind of build our own relationships with substances. And I'm really excited to do this because Mary is also one of my plant medicine sisters. And we've done a lot of, we've done some really awesome work together. So I'm excited for this.
Great, thank you. And thank you for naming that, Charles. Our relationship has gone deep in these spaces. And part of why we can, go deep in these spaces is because it's been supported by Black leaders in our community. And so thank you for naming that. And so I just want to share quickly, why this panel, why I felt the need to have this conversation. This past year, as a community mental health provider, I really saw the devastation in our safety nets. Folks no longer had the same sources to access food, to access the community organizations when COVID-19 hit. And I saw some of my clients pass away due to overdoses and really, this isolation that we experienced. So folks not having the same supports that they had previously. And then also seeing it within my community, right? So people I used to dance with, sing with, and just admire their talents and just be around, lost them this year. And so I felt so called to have this conversation and be a guide in this community care. So important that we share this information, but also from a BIPOC perspective, because it's so layered. And Francis, you already named it, right? And Charles, of the harms of the war on drugs, and how do we continue to build relationship with substances when there's systems that continue to oppress us. And so I think a good place for us to get started is just to talk about harm reduction, the history of harm reduction, and how it relates to drug use.
You want me to take it?
Sure.
I can do this one first, and then I think Francis will have some really interesting things to add on. So I have a few different definitions that we could use. So usually when we walk into trainings for the first time, what we'll say is harm reduction is a spectrum of strategies that people can use to reduce harms associated with behaviors they may be engaging in. And usually when we talk about this, we talk about it from a drug use and a sex work perspective, because those are the communities that built a lot of the harm reduction principles and harm reduction kind of values that we continue to use today. And we think of those spectrum of strategies, including safer techniques. So on a really common level, that might be access to new sterile syringes, so syringe service programs, so that when people are using drugs or injecting drugs, they have access to a new sterile syringe, so they're not at risk for transmitting or contracting HIV or hepatitis C. They're not worried about skin or soft tissue infections. But then that's also things we recognize, even if you're engaging in the same behaviors, there's ways that we can always be safer. So on another side, when I was talking to college students, one of the things I say a lot is, okay, if you're gonna go out and drink, you should probably eat a meal and drink some water and try and get some rest, because all of those things are gonna help you have a better time. They're gonna help your body be able to better process alcohol and other drugs, and it's gonna set you up to be better. So that's kind of what we can think about. Then there's also managed use. So having a really introspective look on what does my relationship to this substance look like, and how do I want to take control of that and manage that? So some people do that by saying, you know what, I only drink after work, or when I drink, I only have 1 or 2 drinks, or when I use this drug, I have this much of a budget for it. And when that budget's out, I'm done. And then we also have abstinence. And so that's this recognition that for different people, for different drugs, maybe the best way for you to reduce your harm is by not using them. And what we see a lot is people who may be abstinent from all drugs, because they're like, that's not working for me, that's not what I want to do, or what's helping me in this moment. People who might use some drugs but not others. We hear that a lot of people who are like, yeah, I use crack, I use heroin, that's fine for me, but cannabis and meth, they do not work for me, and so I do not use them. And harm reduction gives us a little bit of room to play with that and say, like, okay, for these drugs, this is what works for me. For these drugs, this is what works for me. And that might really change based on what point in my life I'm at and where I am in the world. But we have room for all of that. And then there's also another layer of harm reduction, which is a lot more where I feel like Francis and I sit in the rest of our lives, which is, it's really political, because harm reduction is really us looking at public health. It's really us looking at these systems of care and saying, these are not adequate. These are not doing what they're supposed to be doing. Because when we look at the amount of people across the world who use drugs and the very little amount of care that's available for us as a community, that's a problem. That's a real problem. When we're supposed to be talking about, like right now, I'm also working on my master's in public health. And we talk about like these easy wins. We talk about a lot of public health. We're trying to go for these like really large impact projects by looking at the places that have the most harm. And a lot of times these systems have, or at least for a long time, have really ignored the opportunity we have to improve the health of people who use drugs. And so it feels really political and it feels really radical, because what we're saying is, no, this system does not work. We need to improve this system. We need to make it better. And when we recognize that we're trying to center women, LGBTQ people, Black people, and people of color, people who use drugs, people who do sex work, when we're centering those people, we know that we're going to be working towards liberation for everybody.
Thanks, Charles. That's really, really beautiful introduction into harm reduction And I'm hearing a lot about kind of working in that gray area of building relationship, right, with yourself, with the substance, with the people around you, and really thinking about public health in a way that serves people and meets the people's needs, and taking care of our most marginalized community members. And just like you said, when they're taken care of, everyone's taken care of. Francis, I would love to hear more from you.
Yeah, I think Charles did a really beautiful job of summarizing, harm reduction practices and then also the politics of it. I think the only thing I want to add is that I think over the last couple of years, the term harm reduction has become more mainstream, and harm reduction has also been co-opted. So there are police departments who call themselves harm reduction police departments. And so just want to take a moment to clarify that, like, harm reduction is and always has been about redistributing power and resources to people who are the most vulnerable to harm. So it's kind of like a contradiction for a police department that is used to prop up, systems of control and oppression to be harm reductionist. So I think it's important that in this conversation, we reclaim and ground that harm reduction, when the movement first started, it was people taking on daily acts of civil disobedience. It was that the things that they needed for, injecting drugs, for using drugs, so that they can feel well, were being criminalized. And they themselves were criminalized. So it was people just being like, okay, the state isn't going to provide these things for us. So what do we need to do to take care of ourselves and each other? So just like grounding in that it is a radical political act to be harm reductionist, because it's acknowledging, right, that for the people that we serve, right, I can't control if when you walk out of here, you're going to get harassed by the police. I can't control if when you go to the doctor and you disclose your drug use, they're going to treat you like shit, But what I can control is giving you this thing, because, whether it's a clean syringe or Narcan, because I know that if I give you this thing, you're going to be able to take care of yourself and your community way better than I can or any other provider can.
Wow, thank you, Francis. I really appreciate the history and really acknowledging civil disobedience. taking charge of our own health and really acknowledging what what folks really need for public health, and really reclaiming harm reduction and acknowledging that it's not possible to co-op harm reduction in systems that oppress and harm people daily. And so I just want to kind of shift a little bit and kind of talk a little bit about what I experienced as a social worker in the field and what I noticed. And so when COVID-19 hit, I knew, and thank you, Francis, for mentioning this to me just the other day, of like how how harmful this pandemic will be for our people. Knowing that, right, racism is a public health crisis for the past, multiple centuries now. And as a consequence, right, we suffer greatly with high blood pressure, diabetes, other health conditions as related to race-based trauma and chronic stress. And so I knew right off the bat, like we're going to be seeing some, our community members suffer from this. And then in addition, right, as a consequence of systemic oppression, we're in food deserts, we're in healthcare deserts, when we access medical care, we're more likely to experience institutional racism. We're not going to get the same care that other folks are going to get. And while this is happening, right, we are experiencing the losses and the deaths of George Floyd, Breonna Taylor, and our community members, our Asian community members, are being further isolated because of the violence and harassment that they've been experiencing. And so, just as an observer, just noticing this, but also seeing, like I mentioned, the loss of lives through overdoses and the mental health crises that were occurring. So I'm curious to hear from you all, just from a macro perspective, from big picture, what you all saw, from the beginning of the crisis, shelter in place, into now, and just kind of some big picture thoughts and experiences. Francis, you want to hop on?
Yeah, I want you to do this first, Francis.
Okay. I definitely had a list, big picture, but I think, after hearing you lay out your list and, what you just shared, I think I'll keep it more general. So one of the things that we talk about in our work, when we work with people who use drugs, people who experience like multiple identities and multiple oppressions, is that there is a specific kind of grief that shows up that is not always acknowledged or validated by our society. So specifically, there's disenfranchised grief, which is the idea that you're not allowed to grieve, like it's not socially acceptable to grieve, right? Because if someone used drugs because of, mental health or trauma, right? It's kind of like they knew what they were getting themselves into. What did you expect? Like, why are you sad? Didn't you know this was going to happen? And I think when we think about people of color who also don't have access to care, right? They are often also blamed for their own health conditions, right? So like, obviously, with this disease, like, didn't they know that if they didn't change their diet, then they were going to be at greater risk. So like, don't be sad, So there's that disenfranchised grief where you're not allowed to grieve. And then I think in this moment, as we've been kind of facing more isolation, another kind of grief that has come up is just the ambiguous grief. So you're probably very familiar with this as a service provider, where maybe you haven't seen someone in a couple of days, weeks, and you might know that they use opioids, and you might be like, did something happen to them, right? But you don't know. And as the weeks pass, you kind of feel like you should start grieving because you're unsure if something happened to them. but you don't really know. And I think for a lot of us, as we've been disconnected from our friends, right, we might know, right, that our friends might have mental health stuff, family stuff, work stuff, stress going on, but we can't check in on them the way we used to in person. And so it's kind of like the experience of like, when someone doesn't answer their phone, there's like the grief for them too and what they're going through. So I think just like there's the material things, right? Like the housing, job instability, the violence, you know, white supremacy in the news. And then there's also like what we experience in our internal worlds and what we've had to go through specifically as people of color who use drugs, who exist in this space.
Yeah, thank you for naming the different types of grief that you've observed. I definitely identify what you shared, and I definitely didn't have the language, but I know, you know, I can feel it inside, like I can touch the, you know, figure out the temperature, but it's hard to pinpoint. And it's so helpful to name and to know, you know, this person didn't answer their phone and I'm feeling that. And I don't have the same type of access. And sometimes, right, it really has to and really sometimes follow that intuition of, well, what do I do next? And that's complicated, right? And I think that's something we can further explore later in our session together.
Okay, I can say, and I think Frances did a great job of laying out like the social dynamic, but I think there's this like internal monologue that we've all been kind of navigating as well, especially if you are a person who uses drugs anywhere on the spectrum, whether you're more on like a regular daily use or you're just kind of experimental or very occasional. I think people have been having a lot of shifts in their relationships with substances and harm reduction practices over the past, at this point, what, year and a half, where we've had to kind of move between feeling different ways about, oh, there's like a little fly, feeling different ways about like how like, I think I can even talk from a personal perspective of like when you're navigating like your work amping up and having this work that you're having to do in a really intense way, at the same point that you're worried about your family and your friends and like what's going on with this, but there's not really much you can do. Everybody's just like, you figured out people can be home, they're home. If they can't, they're still going out. Like there's not really a lot of room that we had to manipulate. And I think substances are a way that people have coped with that for a long time. And this is not new. Like us coming around this year and people using substances as a way to cope with this grief, this lack of control, this lack of being able to see what's happening in the future, not really sure how to navigate all these situations. And I think a lot of times drugs operate as an escape for people. And I think on the other side, I think people also have a lot of challenge with that of, am I using too much? What is too much? How do I even define that? Like, if I, you know what, if I work all day and then I have 3 drinks, am I a bad person? I don't know. And we're not really often given the opportunity to have those conversations in a holistic way, because oftentimes where we get kind of caught is, I think on one end, we have that abstinent trap, which is like, you shouldn't be doing anything. So anything more than you're doing is too much already. And then we also have that like, you're already there fallacy, which is like, well, I'm already doing this and it's already like too much, so I might as well just like not even think about it or care. And I think something that I've been really gifted with, especially having coworkers who work in this field, having really good friends who I can have these conversations with, is I think harm reduction for me during this period has given me a lot of freedom to be able to say, you know what, if this is what my body's saying it needs or wants right now, or even what my brain is saying it needs or wants, because your brain is part of your body, then I'm gonna do it. And being able to figure out and being able to actually have room to know like, well, this is what safe looks like for me, or this is how I set myself up to be safe while I'm using these substances. And not a lot of people have that. And so I think there's also been this dynamic that's been going on with a lot of folks in relation to their own substance use, where they don't always have somebody to be a springboard for that and to kind of pitch those ideas off of. And so people are using drugs in isolation, not just like physically, but also people are using drugs in isolation, like emotionally and mentally too. When so many people, like especially their drug use has been very social, of like going to events and drinking or smoking or having their friends around, when there's a little bit easier way to say of like, oh yeah, when I like trip over something, that probably means I should stop drinking. But when you're just sitting in your house by yourself, there's not that same feedback loop. And so I think that as a piece of like isolation, not just like there's like that overdose risk that comes from, or even just like harm that can come from when you're alone physically, but also like when you're not being able to connect with other people and use them as like a thinking board for this. That's also a challenge that I've been seeing coming up with a lot of people in my life and a lot of people who I work with.
Thanks, Charles. That feedback loop that you're mentioning is so powerful. And it's something that we don't really know about until we don't have it, right? And so the fact that like, oh yeah, I just spilt my drink. Hey buddy, this is a good time to, let's get you a cup of water, and we like take care of each other. And so we don't have that. And I also just really love that emotional isolation, because so often I am thinking about physical isolation. And so bringing that deeper layer there, and to think about who are the people that I can have these honest conversations with, and really have a framework, around the conversation. And so it's, something you mentioned is, well, what feels good right now based off of how I'm feeling right in this moment, and having those conversations. What felt good last week is no longer, might give us some idea, but what is right now in this moment based off how I feel, based off what I ate today, based off my mood, that conversation I had with mom. And so taking all of that into account is just so helpful. And I think as we continue to normalize this, it's easier to have these conversations compared to hiding it, right? And feeling more silence and really cautious. And so I just really love those examples. And I would just, and just to see if there's anything else, like if from the folks that you work with that are on the front lines, I'm also curious if there's anything else any other dynamics that you may have noticed or people have reported back to you. I love that we started big picture. And so I'm just curious if there's anything else that stands out to you during this time.
I want Francis to talk a little bit more about this, but I also want to say how much harm reduction has been like abundantly proven to be like such a smart way of dealing with all of this stuff. So I'll give you a few examples. So on the first side of like, just like COVID, harm reduction we can talk about harm reduction being co-opted and all that stuff, but ultimately, like when we're talking about disease transmission, that's a place where harm reduction was built around. It's a framework that harm reduction was built around. And it's the same framework that had us talking about like syringes and condoms and all these things. It's also the same way that we talk about masks. And when we like people wearing masks, people social distancing, it's like, here's these practices. These are really simple practices. If everybody stuck to these practices, COVID would have been over in like mid-May. And
no, that's for real.
The places where people who were sticking to them were not having as high as rates. And so like on one end, we saw like very abundantly when you listen to like, and we can talk about like science and like who listens to science and all that, but ultimately it's like when we kind of get these couple of practices and these couple of tools, and if everybody's able to get them, that's what's the most effective way of navigating these situations. And then in different people, and I think there's the politics that has gotten involved, especially throughout COVID, in the way that even these really basic techniques have been politicized. It's really interesting kind of seeing that just in conjunction with like the same way that people go after syringe access programs, in the same way that people, not as much in California, but definitely across the country, go after like abortion advocates and access to safer sex material and sex ed. It's the same conversation of like, this is my personal choice, this is what it's about. And when we kind of recognize that harm reduction is like something we do for ourselves and something we do for other people, that's been something that's really beautiful to see. And then to drive it a little bit back to the front lines, I want to give like a huge shout out to Francis and like Kristen Marshall and Portia Dixon, like all of our team over at the Dope Project at our job, of all the stuff that they've been able to push through in San Francisco specifically, in the rooms that they've been able to be in, and the conversations that they've pushed. There's like this news article that came out maybe a few months into COVID after we opened those shelter-in-place hotels, where people were like, they're giving people in these hotels alcohol and cannabis. I can't believe this. And it's like, first of all, taxpayer money wasn't even being used on that, so we don't even need to like talk about it from that lens. But even more than that, what we know is if you have a bunch of people going into withdrawal from alcohol into a hotel, that is a huge public health issue. And it's a much bigger public health issue than going and picking somebody up some beer and making sure that they can stay in their room and be okay. And when you're able to get people some little edibles, some cannabis, and it's like a lot of people who like being able to get that stuff, that's what's preventing them from going out and going and copying and interacting with people and being more at risk. And so actually being able to provide those materials probably has done a lot to really reduce transmission, specifically among groups that were the most vulnerable. So these shelter-in-place hotels were places where people who were unhoused were being placed as a way to get them out of, so that they had a place that they could shelter in place safely. And so they didn't have to stay on the streets. And I think just being able to have policies like that that are forward thinking, that aren't just like, yeah, this is just the rule. And instead, like, how are we being creative and how are we actually opening up thinking about what is our reality that we're in and how do we actually reduce harm in this situation? Because in this situation, harm wasn't coming from the alcohol or the cannabis or the cigarette. The harm was coming from the respiratory disease that was killing so many people. And so being able to balance those out is something that we as harm reductionists that's like where we come from. It's like, let's weigh it out and let's make that decision together of figuring out like, where is this harm really coming from and what's our most effective way to reduce it.
Thank you, Charles. I really like how you related back to just to wearing masks and how it was, you know, the most efficient intervention, and it became political. And so we see how harm reduction was, became a tool, and really by not wearing the mask really harmed, right, so many people and so many communities where correct information was not being disseminated or misinformation was being disseminated. So I really love and appreciate that connection, and really going back to what Francis was sharing earlier is the need for radical intervention. Is that when you're looking at the conditions at this point, in this moment, what is the most effective intervention, like you said? And in our case, given the current COVID-19 condition, it needs to be radical to keep our community members safe. And Francis, I'd love to hear from you.
Yeah, so I think when I think about, you know, the word front lines, it has just such a different feeling to me now. And yeah, when I think about COVID, it just feels like the amount of bodies that were on the front line just like significantly decreased. So like the people who were on the front lines were, you know, the other day there was a supportive housing provider who said that, you know, when participants came in, they used to be able to talk to like 7, 8 people a week just because everyone was around. And then as the people who could work from home started to work from home, she was like, it just became me. So it was like the same number of people who needed to access resources and that burden, right? And I think we saw in this period of time that we saw like, the working class, right, like people who had to work to survive under capitalism being pit against poorer people, people who have even less access to resources, and just like the safety net being really stretched out, spread thin. And I think one of the lessons learned is just the importance of having harm reduction programs. because we don't just give out, syringes and like safer smoking or injecting equipment. We were also giving out masks. We were giving out alcohol pads, hand sanitizing wipes, and things like that. And I think throughout the last year, we saw at the needle exchange that I work at, we saw that there were a lot of people who might not use drugs. I don't know, we don't know. But just to say it very plainly, there were a lot of like Chinese immigrant elder ladies who would come by and like just get the things that they needed. So like they would come and get their masks, their alcohol pads, their hand sanitizing wipes, right? And these services are for everyone, right? And it's for public health, right? So if they have access to their things, right, then our community as a whole will be safer. But just to show that these programs are kind of like the safety net of the safety net, like when all of these other programs are not providing their people with the essential things that they need, I don't want to say burden, but the burden, falls on these programs to provide these resources for people. And I think that has shown that when we take care of the most vulnerable people and give them access to things that they need, we're actually taking care of the whole city, and that has a ripple effect.
Yeah, thank you for highlighting the wide range of folks that access your services. And I think it's just so important to name that, because so often, right, when people think of harm reduction, they often will think of syringes or, and really there's such a spectrum of services. And I think Charles touched on that earlier. In this case, right, like I need a mask, I need hand sanitizer, I need to get it whoever's offering and whoever's operating. And so this really moves towards my next question is, we saw a lot of innovation this year, and a lot of like mutual aid being popped up, a lot of, like even for myself, like my clients need masks. So I contacted folks who were sewing masks and they dropped them off at my house. And then I went to the SROs and dropped them off, right? And so, so we had to be really creative. And I think that's where harm reduction shines, right? Is that your work is to be radical, is to be creative, is to respond to the need immediately for the greater health of the community. And so I'm curious to hear, what might be some innovations that you all saw, or how did you have to really move quickly to, and I think, Charles, you also talked about the shelter in place, but anything else that you all created or witnessed in your communities around harm reduction during the pandemic and still now?
Yeah, so I think one of the first things that I wanted to lift up was, so earlier I mentioned a project that my friend Rana and I run called the Asian American Drug War Healing Circles. And I realized I didn't explain what it was, but it is a space for storytelling, political education, and reflection for people of the Asian diaspora to reflect on how the war on drugs has impacted them and their ancestors. Because, for Asian folks, right, they don't necessarily experience the harms of the war on drugs here in the same way that Black and Brown folks do, right, who are way more heavily policed, but they have experienced the harms of the war on drugs in their homelands, where the US war on drugs was kind of exported to their countries. So we used to do these circles in person, and in 2020, we took it online, and we found that it was really valuable to have a space like that because, as Charles was talking about before, right, the isolation, the physical, mental, emotional isolation meant that people were using substances, but not having other people to talk about it with, to take care of each other. So to really just carve out some space to, for folks to journal, to reflect, to unpack the internalized stigma that they were experiencing around drug use, or noticing family members increase their drug use, was really powerful, and I think really needed in a different way than it was before. And I think, so that was the healing circles. And then in San Francisco, I think one of the things that has been most amazing was there have been more supportive housing sites who have been taking on the work of overdose prevention. So in the past, in San Francisco, the city agency that oversees supportive housing was always kind of like, it's not my job to do overdose prevention. Like SFDPH, the Department of Public Health should foot the bill and take care of it. But, you know, for 20 years, we've known that people who are at the highest risk of overdose death are people living in supportive housing because they're alone, no one's witnessing them, right? And then I think in COVID, there was this rapid realization that like, if we want to keep our death numbers low, like we have to take on the work. So it's really unfortunate that it took like this global pandemic to kind of force their hands. But I think hopefully more and more people are starting to realize that harm reduction can't just be the work that only harm reduction programs do, that every single program who works with people who use drugs, which I think all of us do, need to take on a little bit of the share of that work. Yeah, to keep our city as a whole safe.
Yeah, that's a huge point, Francis. And I'd also like to acknowledge like that the movement on that happened really quickly. But I'm gonna say the setup took a long time. Like, I mean, we can go back to Eliza Wheeler, who was running the DOPE project for over a decade and just doing a whole lot of work to really set that ground rule, to set those grounds of like, yeah, there's naloxone available. You should be using it. Let's educate you. And then having Kristen and Francis come in and we're kind of tag teaming, going to all these programs, and I'm coming in and doing a little foundations and being like, hey, I know y'all are kind of new to this. Let's kind of talk through this. Why do people use drugs? Let's talk about that. And so then when this emergency hit, we had more of a community who was ready to just mobilize, and it really happened from the bottom up because you had all these direct service providers who were actually dealing with that, who were having to, I mean, like, not to be like too dark, but like really having direct service providers who are the ones going and knocking on people's doors and having to report a dead body. Yeah, it's serious. It's really, and it impacts people. And there's all types of systems that you need in that. Not only just like having overdose prevention, but like Francis has been doing so much awesome work around grief counseling and how do you deal with that grief and how do you deal with the emotional, the burnout and the compassion fatigue that comes from that. There's systems that need to be set up to take care of people so they can continue coming to work when that happens. And you need to set up systems to prevent it in the first place. And so I do think I agree. Like it's hard that this is the thing that had to push it through. But I think it also has been really beautiful to see San Franciscans like kind of band together, because what we've known for a long time is San Francisco, a lot of people are really down with harm reduction. We've always said like the reason there's so much public drug use in San Francisco a lot of times is because when people use on the streets, you are so much less likely to die of an overdose. Because if you overdose outside in San Francisco, you probably will not pass away. There will be somebody who will see you, who will recognize that overdose, who will have naloxone on them and will be able to reverse it. And that is really what it means to be a harm reduction city. And what we have been able to do through COVID is really export these behaviors to all of these different programs. And sometimes one of the things that I've really been focusing on doing this is doing a lot of like just online education. So I've done a lot of online trainings over the past year with all different types of programs to do this work. Treatment programs need to have a harm reduction lens because you still need to be able to support people even if they're not interested in abstinence-based or medication-based treatment. So many housing providers we've been working with, so many programs that work with youth, so many programs that work with elderly. There's like a lot of different need for it. And during COVID, there's been this really big demand that I think for the most part, we've really been able to meet. It's interesting when you do online trainings, how you have so much more capacity or capacity in a different way. You can have a lot of people in your session. You can bring a lot of different people together. It's a lot easier to kind of get a group. And because of that, because especially like all our team at the DOPE Project and Harm Reduction Coalition and our partners throughout the city have really done our best to mobilize and get this education out, because especially as a lot of programs have shifted their services, it's really been a demand that these other programs take on some of this work. Because literally, like, I think for so long, yeah, they were just kind of expecting our harm reduction programs in the city to do it. And don't get me wrong, our San Francisco harm reduction programs, our Bay Area, California, across the country, I connect with so many SSPs, so many incredible people. And there's not enough of us to change the tide of this country. And so it's really been exciting to see specifically like where we work in California, being able to kind of switch that over and really mobilize people to be able to take care of their communities in a more holistic way.
Yeah, thank you, Charles. And it really, what I'm hearing is, right, it's really integrating it and care, right? This is community care. And so the more information and organizations and just, you know, folks, friends and families that have this knowledge, the more likely we are safe. And so it's going back to normalizing these conversations. And so it's just not in the Bay Area, right? It's in every community across the country. And I really appreciate all the, you know, the trainings and information that's online on your organizations. And at the end of our event today, we're going to send out the resources that you all shared so that folks can have access to that and know where to turn so that they can train themselves or hand it to their organization. Hey, like, this is something we need to integrate and have a holistic approach like you're mentioning. So I'm just going to kind of shift a little bit. And because I think you all did such a beautiful job of like the lessons learned as well. But just because I'm cognizant of time. And I just want to kind of bring some psychedelic stuff in here. As BIPOC community members, right? We also, right, we're developing these relationships with substances, and folks are becoming more interested in psychedelics and exploring psychedelics, learning about psychedelics. And you know, we have to be really thoughtful about this, right? We continue to suffer from the war on drugs. We're more likely, right, to be racially profiled, surveilled, followed, and we're disproportionately arrested and suffer from mandatory sentencing. So thinking just about, you know, psychedelics and any other drugs that come to mind, how can we reduce risks, right? Increase our safety as we start to maybe experiment or, you know, just build this relationship with psychedelics. Either of y'all wants to start?
I have ideas, mostly because, the reason I'm really excited about this is because I've been doing some really cool work with one of my dearest colleagues, Ashley Rojas. If you don't know her, look her up. She's one of the hardest working people in the California. She right now is the executive director of Fresno's Barrios Unidos, and is doing a lot of work around educating and mobilizing youth around harm reduction. And part of that has been implementing this curriculum called the Safety First curriculum. If you're interested in teaching about youth about substances, please look up the Safety First curriculum by Drug Policy Alliance. I think I'll have a link that I'll send, that'll be in the follow-up email as well. But there's like a lot of really basic stuff that we can all do. I think number one, take care of yourself and like those basic needs like food, water, sleep. That will get you really far. Giving yourself a strong basis and being able to support yourself with that is going to do a lot. I think also setting intentions and knowing what you want. And the intentions don't always have to be like, I want to talk to my great grandmother and see what happened in the situation. It doesn't have to be like that, but it can be like, I want to connect with my emotions, or I want to relax, or I want to paint and see something really beautiful. And all of that is super great. And when you set those intentions, that'll really line you up well. And then last, if you can, like having a connection or a person who has experience with it is also really great. Whether that is somebody who is with you, who can kind of coach you through, trip sitter, or even somebody who's using with you who has more experience. I found during COVID that it's really, really effective to even have somebody just on a Zoom call, so that if it feels that you're feeling something really new, you can talk it out and you can have you can have a conversation about it. So it's not just kind of sitting in you. Psychedelics are really interesting. They're a really interesting medicine because they bring up a lot of stuff that could be really new or different for us. And I really want to, I think that's a really awesome thing to explore. And it's it's not always just a game. And it can feel really different for different people. So being able to like take care of yourself on the base so that you're all right, ask for what you want, and be really clear what you want, and setting your mind in that so that you have somewhere to go off of. And having somebody that supports you, because that's going to go really far. Because especially like if something feels really new, it can feel like reality for you really quickly. And I think somebody being able to be like, yeah, that's real, like that's happening in your brain, but that might not be what's happening in like everybody's reality. And being able to have somebody like bring you back from that can be super, super helpful if you're exploring stuff for the first time, or just kind of new.
Thank you. Frances, any thoughts about folks exploring psychedelics for the first time or experimenting?
Yeah, so folks are probably familiar with the drug setting model, just in assessing the different variables, right? When we take psychedelics, the different variables that can influence safety. So drug is just knowing the drug, set is kind of checking in with yourself around your emotions, mindsets, did you get enough sleep, water, food, and then setting, right, which is your environment. Do you have people around you, like community guides that Charles talked about? I think for BIPOC in particular, it's also important to bring in this piece of reflecting on our own histories and also our ancestral histories. Because as Charles said, psychedelics are one of those are in the unpredictable category of drugs. And so we can set intentions, but these plants have their own agency and we can't always control what comes up. So just I think for BIPOC, there is always like a greater risk that something comes up that is more traumatic, right? Because of the history of white supremacy in this country. That maybe white folks might not have to think about when they're taking psychedelics. So I think that it challenges us to have a greater level of not only self-care, but also community care. The second thing I'll mention is that if you are a guide, initiating someone into the plant medicine world, I would say, even marijuana is a psychedelic, right? Because it's one of those unpredictable substances sometimes. So even if it's like just marijuana, be a good marijuana spirit guide. I can't tell you how many stories I heard throughout college where people are like, my first time smoking weed, I was already super drunk. I took a huge bong rip and then I vomited and I'm never smoking weed ever again. So if you're that guide, right, just be very mindful that you're initiating someone into this whole other world and to really take care of them. And you have that responsibility, right? You're kind of like the marijuana ambassador in that moment. And it's the same with all plant medicine. So that's all I'll say about that.
Yeah, thank you so much. Right. This community care, right, of acknowledging, hey, if we're sharing this experience and I know that this is something new to you, it is now my responsibility that you have the best information that is available. And if we are at a gathering, maybe it's more than one of us that's kind of keeping an eye and checking in. And checking in, how are you feeling, how are you doing, and I really love, Frances, you acknowledging some of the ancestral trauma that might arise. And so it's so important to be around folks that, hey, if this arises, and that I feel safe to share that with my trusted guide or my trusted friend, that I don't need to suppress it because I don't think they can handle it, or I'm not sure if they're going to validate this experience. And so something to really think about. Anything else on that?
Yeah, this also, you saying that, Mary, also just made me just think about saying this a little bit more explicitly, but like as people of color, like having people around you that you trust is so important. And maybe for you, that's also having people of color. So just like saying that very explicitly, like having used like different substances in very white spaces, sometimes you don't always feel safe and comfortable. And that's fine. This is about you. Don't worry about anybody else. If you are going on your own psychedelic journey, if you are using any substances, worry about yourself. Worry about like, this is what I need in this space. And when we talk about that set and setting, it's like, and you know what, if there's any young kids or anybody who's really new to substances out there, if you don't feel safe, you don't have to do it. And if you don't feel comfortable, it might not be this might not be the time. Like, look, if there's one thing I've learned about drugs, is they will come back around. There is never only one opportunity. So like, if you're not feeling safe and comfortable, you don't have to do it in that moment. You can even just like kind of explore. You can take way less, like a really small dose just to try it out. If that's what feels safe for you. But also like, I think especially as the world starts opening up, there's some really intentional work that people have done, and there's really intentional work that you can do to find like a community or even a person or some people who you do feel safe exploring this with, if this is something you're really interested in. Because just like Mary was saying, things come up. And if you don't feel safe talking about how like structural racism, if that's a reality of your life, if you don't feel safe talking about like the experiences of your grandparents or your parents with people, like, is that what you want coming up around them? And that's just going to kind of sit on your heart, and you're not going to be able to express that as freely as you would like to, with fear of making somebody else uncomfortable or sad or drawing some ire or whatever that might be. So I'm just going to say, like, if there's a moment to kind of be selfish and really think about what you need, it's when you're trying a new substance for the first time, because you need to feel safe and comfortable, because the more safe and comfortable you feel, number one, the better experience you'll likely have. And if something goes wrong, you'll want somebody who is actually there to care for you as an individual, and gives you what you need, whether that is just like a really calming voice or a cup of water or an invitation to lay down or a hug or whatever that might be.
Thank you, Charles, and thank you for being explicit. I appreciate that. And also just naming too, like, yeah, the need might be, can I have a hug right now? Can I hold your hand? It helps me feel grounded and safe. Or can we take a walk? Like, I'm feeling overwhelmed. And so really acknowledging that need and naming that need, so that you can get the supports that you need in the moment. I'm being aware of time, but I think this is a really important topic. So if we go over it, that might just be, but something I've noticed in my psychedelic circles and also in my psychedelic education is folks distancing themselves from other drugs. And so there was one instance, a presenter said, this isn't crack cocaine. And I immediately, became enraged and just felt this like pain in my body of like, this person in this white dominated space just perpetuated, these false beliefs on war on drugs. And just really felt that pain of like, our communities that have been so harmed, the transgenerational trauma that we've continued to experience. And so I have a few questions around just firstly, like your thoughts, how also we need to be aware if, we're perpetuating that language and the false beliefs of the war on drugs. And finally, how do we dismantle that, or how do we interrupt that in different spaces? Francis, you want to go for it? Yeah, because this is real, it's happening.
I really appreciate that you brought up the war on drugs, because I think this is where there's room for compassion. It doesn't mean we can justify those beliefs, but like understanding where beliefs like that might come from, right? Because the war on drugs is a system of oppression, like many other systems of oppression, kind of pits people who would be natural allies against each other. So whether it's like racism, right? I know in the Asian community, there's a lot of like, oh, well, I'm a suburb Asian, but not a Chinatown Asian. Or if you're like an immigrant, right? You're like, I'm a legal immigrant. I'm not an illegal immigrant. And there's kind of like this, there are these systems of oppression that impact all of us, but because we are pressured to survive under white supremacy and capitalism, there's a way that we want to be like, I'm not like that, person in this group, even though the same system of oppression is impacting all of us. So drug users are divided against each other too. And I remember in college, like the people who drank alcohol would like judge the people who smoke weed. We see like where people who smoke marijuana, right, judge people who smoke fentanyl, or like people who snort or smoke a drug, judge people who inject, right? And there's all these divides when we would actually be natural allies in dismantling the war on drugs. And so in terms of dismantling, I would just offer that if you ever have a judgment about a drug, just to ask yourself why, because usually that judgment is linked to racism and classism. And that's because, right, if we take San Francisco as an example, when you walk through San Francisco and you see visible drug use, right, when you see people who inject drugs and there's this association built up over time in the media too, right, that it's associated with like homelessness, crime, severe mental illness, all of these things. What you are actually witnessing is not an inherent quality of the drug. What you're witnessing is the effect of poverty and a severe lack of resources. So instead of talking about the drug and criminalizing and judging the person who's using the drug, which might be their only resource to feeling okay in that moment, right? I think we need to talk about the poverty and the racism and why it is okay that we let our people be like that, right? Instead of doing more to take care of them. So that's just kind of like my 2 cents. Yeah.
Yeah, that is, yeah. See, this is why I love Francis. So I just think that is so poignant, and that's literally what it is. There's all these systems that tell us what to think about drugs, and I have a few questions because I do trainings all the time, so I have these questions that I like to ask people. One of the questions I ask people is, do you think that every single person who injects heroin in San Francisco is homeless? And the answer always in every room is like, no. Do you think, I'm like, do you think they all make less than $50,000 a year? And everybody's like, no. Like, do you think they make less than $250,000 a year? And everybody's like, no. I'm like, you're right. There's people in all these expensive ass buildings and all these bougie offices who are doing the exact same thing as that person that you're talking shit about down the street. The difference is how much of a quality of substance can you buy? That's going to be a huge thing about risk, because when you have resources and you can get a consistent substance and one day I'm going to use it and this much is going to be this strong and the next day this much is still going to be this strong, versus when you're buying by the baggie or when you're buying something more like black tar where there's a big mix, and the cheaper drugs are, the more unpredictable they tend to be. Not to mention, like, are you coming home and finishing up your work and cleaning off your surface and putting a Sade CD on and having a little calm moment while you inject? Or are you having to try and hide under your coat because there's kids walking by and you're not trying to get in trouble or get somebody kicking you in the head because of all the violence that you can experience because you're a drug user on the street? And so like that's like a really big thing that I like people to hold as well, is like drugs are not as class-based as you would like them to be. Even if we talk about crack versus cocaine, the only reason racism exists in that, the only reason there's a difference between those two drugs is racism. You take cocaine, you mix it with some baking soda and cook it, you got crack. It's really that simple. It's less strong. It's not doesn't give any those racist, like, I mean, we've seen during this trial for Derek Chauvin of these like all these different ideas coming out of what drugs do to people. We can get into that probably in the Q&A, but giving people superhuman strength of all these things, none of that's real. The difference between somebody who uses crack and somebody who uses cocaine is usually just income. That's usually just the only difference. And so like what Francis said of like, and all what Francis said around like really questioning yourself when you're feeling judgments around those things. Also coming back to like, what was your first experience learning about drugs? Because I know that when I was when I was young, and I would be walking down the streets with some of my aunts or my godparents, and like I'd be cutting up in the street, and they'd look at me and say, "You see that homeless person over there? If you keep cutting up, that's what you're about to be." And that's the associations that you start to build. When you're going through your DARE programs, or you're in your drug education in middle school and high school, when they're bringing all these drugs in and saying like, yeah, if you use all these drugs, these are all the bad things that happen to you. You die, you get addicted, all these horrible things that happen in your life that aren't really a reality, except for the fact that we create that reality. We make that the reality because we say, oh, you said you used drugs on this job application. No, I'm not hiring you. You said that you were arrested for drug use on this housing application. I'm not gonna rent to you. You told somebody told me that you are somebody who has smoked crack before. We're not friends. You're isolated. You're not part of this group. And so the more that we kind of pull in that exceptionalism, it actually causes a lot of harm. And I think it's really interesting here in the Bay of like how we've had these couple of laws passed, I know especially in Alameda County, that like those like decriminalized nature campaigns that I think are interesting, but not very radical, because basically what they're saying is the way that I use drugs is fine. Not to mention the fact, not even to mention the fact that most of the drugs that we're kind of talking about in this situation these campaigns are being pioneered by white people for drugs that were typically used by specifically indigenous communities in the Americas and throughout the world, and who were actually criminalized for using those substances at different points. Very heavily, like around peyote, ayahuasca, like there's a lot of criminalization that happened with indigenous people around those substances. But now that there's a different people using it, there's a different class of people that are using it. That's the conversation that we're having. And that's always what it's been. When you have rich white people who are using a drug, it's legal. Or if it's not legal, there's a way to access it that is legal for them. And so being able to really push through that thought and really recognize that it's like the only difference between your Adderall and somebody's crystal meth is a carbon instead of a hydrogen. That's it. That's really it. And the difference is you're getting a consistent pill that you know how much is in it every time. So it's easier to dose, it's easier to plan, versus this person getting this meth, they don't have that same luxury. And we got to hold that, because people use meth for the exact same reason that people use Adderall: to wake up, to finish their homework, to go to work, to be able to focus. It's not that different. And the more that we kind of drive those differences, the less room that we actually create to talk about what does safety look like for everybody, and what does it look like for everybody to have access to this lifestyle that people who have resources want as well.
Beautiful. Thank you so much, Charles and Francis. I just really appreciate both of your perspectives and how you beautifully just intertwine all of it so nicely together. It's such an honor just to be a student from being a student right now. And this is a great time if folks have questions to throw them out there, because we'll transition to some Q&A. But before we do that, I would love to hear how people can find you, or what organizations, and of course we're going to send that information out, but just to name some of the organizations that you all work with or that you like to uplift before we go into Q&A.
Francis has something she wants to talk about.
Thanks, Charles. So I started a food blog. It's called Food Set Setting. So I graduated the nutrition coach certificate at the end of last year. So it is nutrition grounded in political education, harm reduction, and also astrology, which is another one of my passions. And if you're interested, so you can go to foodsetsetting.org for that. If anyone's interested in hearing more about the healing circles, you can go to politicaldrugeducation.org. And if you do overdose prevention work or want a training around that and you're in San Francisco, you can find the DOPE project, Drug Overdose Prevention Education Project in SF.
Awesome. I'm so excited for all this stuff Francis is working on. And yeah, and if you want to continue connecting with harm reduction, I really suggest following us at National Harm Reduction Coalition. So harm reduction or Harm Reduction Coalition on pretty much all of our social media, or you can just go to harmreduction.org and you'll find all of our stuff. We have a lot of really awesome resources that kind of explore like all of these relations to people and substances and sex work and how all of these things kind of mix together to create this really strong political and public health ideology. And yeah, I think it's really awesome. I'm really excited to see how we're going to continue to grow, especially as the world opens back up.
Yes, thank you. And Francis, thank you so much for your work on Dope Project. It's a resource that I often turn to have an idea of what's going on, the information I use to share with my clients of the movement of drugs in San Francisco and kind of preparing and keeping that conversation going. So thankful for your work and for the organization that puts this information out there and makes it really accessible. Okay, so let's look at some of the questions here. So great question for you all. Do you think that the war on drugs has made harm reduction more difficult in practice?
The war on drugs made harm reduction. That's the reason
yes.
I am a strong believer in that harm reduction organizations should not have to exist, because this is the work that doctors should be doing. This is the work that teachers and health educators should be doing. This is the work that should be getting done in postnatal organizations. This is like, we're really just here as ambassadors to try and educate so many people. And I think syringe access programs are really dope. They're some of the coolest sets of people I've ever worked with. And there's so much talent and knowledge and skill around connecting with the community that exists there. And harm reduction exists in the way that it does in this country because we have a criminalized and punitive way of dealing with substance use that doesn't take into consideration people's health. And that's what we have to do. We're not necessarily doctors, we're not necessarily nurses. I love when we have actually some really awesome doctors and nurses who do harm reduction work, who are able to actually sit down with people and say like, hey, has anybody ever taught you how to inject so you're not hurting yourself? And we've been able to pass that information on. So we get taught and then we teach it to other people. We have our medication around naloxone. The reason that we have to do such really wide scale naloxone distribution is because a lot of people will not call the hospital. They will not call an ambulance. And what we were seeing before naloxone became really widespread, and in places in this country where naloxone really is not widespread, people just die, even when they have folks around them. Because if you call the police, we're having all these laws around like that are coming out around drug-induced homicide and like all these things. So drug-induced homicide are laws that are being passed in different states that are basically creating a legal framework to charge people who sell drugs mostly, but also people who are kind of associated with people who are using. So like the way a lot of these laws are written, if you go buy some drugs and split them with your friend, and then your friend overdoses, you can be put at risk. You can be basically charged for their murder. And that doesn't put people in a space where they want to actually talk to a medical provider or somebody who can make sure that they are healthy. And so we're doing this work because these systems are not doing this work. And so that is really where this is kind of sprung from. So even going back to some of the first harm reductionists who were doing this work, so like Dave Purchase or the original Harm Reduction Coalition, which was just a meeting of harm reductionists who are doing this work across the country, who came together and said, we're all doing this in different ways. Actually, that first ever meeting happened here in Oakland, California. So Oakland, California is one of the first hotbeds of harm reduction that exist. And yeah, and it was created because these people who are like, we care about our community. We care about our friends and our family, and nobody is taking care of them. So you know what we're gonna do? We're gonna go out and we're gonna hand out syringes. And they got arrested. They got put in jail for pretty significant periods of time at different points. They were fined. So this wasn't just like some little cute weekend volunteer work. Like this was like real political stuff that was like on par with a lot of the other political movements that were happening in Oakland and across the country at this time. The Black Panthers, the Young Lords, like they're in the same vein. And as we've kind of moved through, especially we can see kind of the same path that happened around like HIV activism, where it's just kind of gotten a little bit more corporate. It's gotten more kind of nonprofit and placated. But ultimately, like this is still a really radical idea that was only born because the war on drugs created all of these opportunities for harm. And I also recently noticed while writing a paper for school that this June is actually going to be the 50th anniversary of Richard Nixon declaring the war on drugs. 50 years, and we don't have anywhere near less drugs. So if that tells you about the success of this campaign.
Yeah. Thank you for sharing that, Charles, and thank you for continuing to be continue to do your research and your learning so that we can integrate the history and really acknowledge the folks that put themselves in harm's way to protect community. Anything that you might want to add, Frances?
Yeah, I think Charles really said it well, that the war on drugs is the reason why the harm reduction movement has to exist. And I think one of the examples that I think all of us are familiar with, where the war on drugs has impacted us, is the example with alcohol that I always like to share. That if you ever had the experience as a young person and maybe a friend passed out from drinking too much alcohol, and you had to be the one to be like, should I call 911? And instead of, calling for help right away, I know for myself, instead of just confidently whipping out my phone to call 911, what I started to do was like make all these calculations in my head. It's like, if I call 911, are they going to get kicked out of their housing? Are their parents going to be notified? In some states, they might lose their kids, their homes, their jobs, all of these things, They might lose their financial aid, get kicked out of school. And so that is kind of an experience where we start to internalize the war on drugs, because we know deeply, that even though calling for help should be the easiest thing to do when someone's passed out in front of you, instead we start to make all of these calculations, because while we might save that person's life, they might lose their safety, dignity, and belonging in some other way. And that's kind of like one of the first instances where we as young people learn about the war on drugs, maybe without even being explicitly taught. And if you call 911, it's like, even if quote unquote, like nothing happens, just the trauma of interacting with police while you're inebriated, while you're young, while you're worried about your parents finding out, is its own trauma. So yeah, I think Charles said it best when it's the war on drugs that made it so that harm reduction has to exist. And I think I agree with Charles around how, nurses and, the medical field should take on this role. And I also think, given my own medical history, I have a lot of distrust of the medical industrial complex. So I do think there will always be room for community-led harm reduction initiatives. Just community response around health.
Great, thank you, Frances. Let's see here. What would you all say to folks who believe decriminalization will lead to an even bigger opioid crisis and more overdoses?
We have a lot of evidence that it doesn't.
Yeah, maybe share that evidence.
Yeah, so speaking from some different lenses, I know one of the best perspectives we have right now is in Portugal, where Portugal has decriminalized possession of small of personal amounts for the most part. I think there is still some criminalization of really large amounts, but there is decriminalization for use and possession for individuals. And they also have some pilot programs, I think, around like medical grade substances as well. So people being able to get like prescription substances and opioids in order to manage their substance use challenges. And what we've seen is there haven't been a spike. There's actually been a pretty large reduction in substance use, because what we know, number one, is that a lot of substance use is connected to disconnection from community. It's connected to a lack of care. And what Portugal has, which maybe what we can talk about, what we don't have, is universal health care. We don't have housing for everybody. Those are really the issues. If we want to talk about reducing drug use, like those are where we start. Then criminalizing it has done nothing, because like I said, 50 years. And what does drug use look like? More people are using than ever. This opioid epidemic happened under criminalization. Like it's always these I think when we think about criminalization, it feels what is safe and comfortable to us. We know, we have been taught how to talk about drugs through a criminalized lens of like, if somebody's doing this, that's bad, and if they go to jail, that's their fault. Like, and maybe we still use, and that's the thing, is like people who still use substances who are illegal still say that. And we know that that's always going to be racialized. It's always going to follow along class lines. But ultimately, like, people are really comfortable with punitive measures because that's what we know. But the truth is that's not actually effective. Even if our goal is to have nobody using drugs, punitive measures are not how we get there. And they've never been how we get there. Even going back to like the 20s with prohibition, people didn't stop drinking when alcohol was illegal. What happened was rich people stocked their cabinets with a bunch of wine. And they were fine to go for the length of prohibition, a lot of them. And poor people ended up drinking a lot of things that were not great for them. Whether that was bootleg liquor that had a lot of fillers in it, whether that was medications that had alcohol in it. I'm gonna plug my little sister real quick. My little sister also is a harm reductionist, Kay. And Kay has actually done a lot of research around how Jake leg, which is a disease that people would get from drinking Jamaican ginger, which was this medication that had some pretty severe neurological effects. But because people really wanted that alcohol, they still drink it, and they dealt with these effects. And there was a lot of political education that had to happen around that, that wasn't coming from health departments. It was actually coming from the community. And what my sister studies is actually from blues singers who were singing about the effects of Jake leg, educating their community, because even at that point, they were not doing the epidemiological work necessary to actually know what was going on in poorer communities around their alcohol use. And so like ultimately, criminalization has just like, it just causes more harm. It makes things more dangerous for everybody. And when things are more dangerous, it becomes even harder to kind of leave those situations. When things are really simple, when it's like, yeah, I can walk into the store and buy cannabis if I want, but if I don't want to, it'll still be there later. I can always come back to it. I can take a break and come back. I'm not stuck here, and I'm not being judged. I'm not being labeled as like, just because you buy an edible in San Francisco doesn't immediately make you a pothead or a junkie or any of these things, the way it does with other substances. And so criminalization and stigmatization actually take us farther away from people being able to use in a way that's less harmful. And it also prevents us from being able to do things like actually know what's in our substances, because those are the things that actually reduce overdose, is being able to have a safe supply, everybody having access to housing, everybody having access to the food that they need, everybody having access to medical care that centers the dealing with the root of their issues, as opposed to just giving you drugs to deal with it, or giving you a surface level treatment to get you out of there, but actually having a medical system that's committed to your deep wellness and health. Those are the things that prevent overdose. And those are the things that prevent people from having more chaotic and harmful substance use more than anything else.
I think that was a beautiful response. And the only thing I want to add is that, and this might be kind of controversial. Well, this part isn't controversial, but I think just to say that just because someone uses, it doesn't have to automatically lead to death. So that question, right, around what if, I'm forgetting the exact wording, right, but the what if more people start using, right? And this is the controversial part, right? But for me, I actually don't care if more people start using, right? And I think we need to ask ourselves, like, why are we so uncomfortable with the idea of people using a substance to cope with pain when we know that life is painful, right? To relax, to be creative, to have fun, to socialize, you know, to have pleasure. Why are we so uncomfortable with that when what we should really be uncomfortable with is the fact that we let people die trying to find relief for their pain? So for me, it's not that, you know, more people could use, but if they had access to all the resources that Charles just named, it doesn't mean they have to die, right? If we do the work of organizing and culture shift and one-on-one conversations, then that also, you know, creates another level of a safety net. So that's kind of my view on that.
Yeah, thank you for that, Francis. Yeah, it's so interesting, right? Of like, why are we so concerned? It's like sex too. Like, why are we concerned who's having sex with who, and why are we so like, you know? And clearly, this is like a conditioning, right? Of like what drugs this person's doing and how often, and so it's a great question, and I think it goes back to something I think you said, Francis, earlier, of just like going back to ourselves, like, well, and I think, you know, Charles, you also touched on it, like, well, what was the first time I had that thought, or what was my first memory of it? Because, right, we are getting all these messages, and even if we don't, you know, we're not necessarily even noticing the messages, they're still hitting us in some capacity and sometimes sticking. And so it's such a great way to be curious. And I just really appreciate that perspective. This question I have here is pointed towards me, but I do think it will also point to you, Francis, and your work and your healing circles that you facilitate. The person says, I'm a current MSW student who plans to use harm reduction in my practice while also using it in my own life. Beautiful. How do you balance understanding your own journey with substances while also providing services while providing these services for your clients? And Francis, feel free to take that on.
I think I really appreciate this question and the work that you're doing, because I think the more work that we do in unpacking our own relationship to substances, the more powerful we are to support other people on their own journeys. For me, I think, I know for myself, there's kind of this pressure that I've had to have like a always forever and perfect, like healthy relationship with drugs, because, you know, people will ask me questions about that stuff. And so I think the first thing is to just also acknowledge that you are human and going through life, and your journey will also change. For me, Charles mentioned this earlier, but just like always checking in with intention is something that I do over and over again. And then another tool or framing that has been really powerful for me is thinking about my drug use as a relationship, that it's not this like passive thing that I just ingest and then it does something to me, but that all relationships you have to work on. And so coming at it with that. And then lastly, one of the things that we talk about in the healing circle is also reciprocity. So it's just acknowledging that every time we take a drug, every time we eat a food, right, that we are taking something from this earth. And it took people to cultivate that plant. It took water, sunlight, all of these resources, right? A whole distribution pipeline. So something that has been helpful for me is like, when I feel like my relationship with a drug is out of balance, I try to think about what can I give back to the earth, and what is the thing that's, you know, like what the drug is also asking me to do out in the world. And for me, sometimes it is spending Saturdays doing talks like this. Sometimes it's like taking a call with my friend who's interested in trying a psychedelic. But those are kind of like my guideposts.
Yes, reciprocity. So important. And I love how you brought food into the conversation, because like you said, it takes so many hands to get to the market or the farmer's market, to the grocery store, but also so many minerals, right? We rely on the water and the soil and need to ensure that it's healthy and balanced, so that we have this food, but also so that we have cannabis, or we have psilocybin, mushrooms, right? And so I definitely integrate that in my practice, and in my practice working with folks who have a relationship with cannabis, of really connecting with the plant and acknowledging the plant, and having that ongoing relationship, and really being aware of the powerful nature. And so it's respect, it's that mutual respect. And so I think that as we kind of have those conversations, we get to be more nuanced, and really remove ourselves from extraction. And it's a practice of decolonization, that we can come back to the land, and think about each process at each point, and that we're just not consuming. So thank you for bringing that up. So it's so important. So I have one last question, and I think it's a great question for us to end on. It's a little bit more on the psychedelic stuff. So what would you like to see the psychedelic community do better in regards to supporting BIPOC folks?
All right. I think we can talk about this from a few layers. I think number one, you should be doing work to dismantle white supremacy just in general, because it's all, I think we can think about these as all separate systems, but they're really all the same thing. They're all white supremacy, patriarchy, that is capitalism, that is working to remove power from who it can and give it to who it wants. And those tend to be people with more money, white people, men. That's just kind of the general rule. And so doing the work to actually dismantle that in your general life, like in your workplace. How are you creating space for people of color in your workplace? How are you naming when white supremacy principles are coming out in your workplace and in your personal life with your friends, with your family? Because it doesn't just start when you walk into a ceremony. It doesn't just start when you start doing mushrooms. Like there's so many things that are leading up to that, because what that's going to do is like, just Octavia Butler, like talking about everything you touch changes, and everything that you touch and it changes you as well. When you go out and you are changing your systems of white supremacy, that's also changing you. And that means when you come in to do ceremony, when you're coming in and using psychedelics with people of color, you are in a place where you're actually better to do that. And you're not harshing the vibe, to use a simple term, I guess. And then I think that there's also a lot that we can do around understanding where psychedelics also are connected to the war on drugs, because I think what I am really comfortable and what in my work I talk a lot about is like these really criminalized substances, crack, methamphetamine, heroin, fentanyl. But the truth is, like, all of these substances were criminalized at different rates throughout time and throughout place, depending on who's using them and how they're using them. And so also, like, when we talk about really loved what Francis said about acknowledging, like, this is a reciprocity thing, like this is something that comes from the earth and it's giving something to you and you're giving something back, and it's a relationship. Because the white supremacy tells us that you're taking, and you're coming to your ceremony, you're coming to this thing to get something and to grab something and to use something. And like, no, like you're coming here to have an experience, to connect. You're coming to give something back as well. And so really pushing yourself to push through that white supremacist thinking at all levels, not just like in the ceremony, not just with the drug, but with all of that, is going to set you up to be a better person and to be a better ally, a better community member with people of color in general.
I want to bring in a quote from my friend Ismail, or Izzy Ali, who works at MAPS and is one of my friends, mentors, teachers. And one of the things that he told me when we started the Healing Circle work was that anything that challenges the notion that we are alone is inherently psychedelic. So I love what Charles said about the movement work, right? Because the more we can build solidarity across race, class, drug user identity, right? That is also like, I think, what the medicine asks of us. Yeah, and to further all of these movements too for our greater health, liberation, and wholeness.
Thank you, Frances. I think we'll leave it right there. That was just so beautiful. And I just really appreciate you both for making this time. It's so clear how committed you are to this work and how deep you both have dived, not only to harm reduction, but also your internal work, right? And really, it starts with ourselves. And it might be through psychedelics, but it also might be connecting to a community elder, right? Or connecting to an organization, or connecting to the land. And so I just really appreciate you both for being here. And I really appreciate and value the folks that participated in this educational event, and being here with us and sharing your questions and comments. It's such an important conversation, and it's really for us to use this information and to share it, right? And that when we share this information and we take care of our most vulnerable folks, like mentioned earlier, we are all taken care of. And we work together for the greater movement, we will all be safer. And so I just really appreciate this time together and the trust that you both have in me to facilitate the discussion and being so vulnerable and open around your experiences. And so we'll be sending out this information, some of the really cool organizations that you shared, also some podcasts, and also some articles that I found around psychedelic integration and harm reduction. So check that out. And also, if you haven't added us to Instagram or Facebook for People of Color Psychedelic Collective, please do so, as well as Twitter, and that you can continue to be participants in our educational events. Thank you so much. Appreciate you all, and enjoy the rest of your day.
Thanks, y'all.
Thank you.